Hi, my name is Brian Damitz. I'm a podiatrist with Lakeshore Bone and Joint Institute in Northwest Indiana. Podiatry is a very interesting field for me. As I was growing up, I always knew I wanted to be a doctor. I always was intrigued by podiatry. The foot and ankle is a very complex structure, and it's just amazing how all those bones, muscles, ligaments, and tendons all work together, and just such a complex area, and I love that I'm so specialized in one area. I know it's cliche, I like helping people. Nothing's better than when you have a patient walk into your office, they're hurting, they're hobbling around, they just can't make it through the day, and they come to your office and you do something, whether it be a cortisone injection or some kind of other treatment, and immediately they feel better. It's just the most rewarding thing you can have. I specialize in all foot and ankle surgical techniques, but since joining Lakeshore Bone and Joint, I have found myself majority of my cases involve ankle and reconstructive type surgeries, but I also do everything from hammertoes and bunions to complete, repair of ankle fractures. To tell you the truth, I really enjoy ankle arthroscopies. It's a very rewarding and actually fun surgery because you can see everything through one tiny camera, and it's non-invasive, and a lot of my patients are walking out of the operating room and you see the results immediately. During my training in New York, I was involved with a residency that was able to work very closely with orthopedic surgeons and with podiatrists. And I feel that my experience working with both doctors that dealt with foot and ankle injuries, I felt like I had a complex and comprehensive training that I could incorporate and figure out what I thought was the best approach. Patients should come and see me when anything hurts. I say don't hesitate, because there might be a scenario where getting to something or figuring out what's wrong quicker may get a person better sooner. I see a lot of people that have ankle sprains. I often see them immediately, directly from the ER, within a few days. But I also have patients that I see a month, 2 months out after they had an ankle sprain. So the patients that I see immediately, I aggressively treat. And I put them usually in some kind of an immobilization device, and we follow up very closely and regularly. And I ensure that their ligament has a chance to heal. Unfortunately, some people that come in a month, 2 months later, they've been treated maybe not as aggressive as I would have treated them. And I find that sometimes their ligament may not heal correctly, and oftentimes, unfortunately, they end up having to need surgery. What do I like to do when I'm not working? When is that ever? I'm just kidding. I actually enjoy video games, which may be a reason I like to do ankle arthroscopies. But I like to do video games. I also like to landscape. We have a new house. I've been working on that. I'm married to Emily. She's a physician assistant with Dr. Toma, who's another doctor in Lakeshore Bone and Joint Institute. Lakeshore Bone and Joint Institute is, to me, a very, very comprehensive group. I love working with them because I know that there's a doctor for everything from head to toe. I know that there's a person that if we don't feel comfortable treating, that there's going to be somebody else within that group that we can send to. And Lakeshore Bone and Joint, in my opinion, has some of the best doctors that I've ever worked with. With workers' compensation patients, I do have a policy that within 24 to 48 hours they should be seen in my office. Sometimes, and I would say pretty regularly, we can get the patient in that day if it was something necessary. I also would always be willing to go to the emergency room if that would be needed, and we will take care of the patient as quickly as possible. In my opinion, most patients should go back to work immediately. Some with restrictions, some with light duty, some may be able to go back to full duty.